EAT is a long-term initiative to link food, health and environmental sustainability across science, business and politics. And one of the objectives of EAT is to increase the multidisciplinary knowledge platform, stimulating more interdisciplinary research, but also to ensure that this knowledge is transformed into concrete action. And therefore we aim to work with private sector and to spur healthy and sustainable innovation along the value chain in the food industry itself. So in order to do this, we, in a mid-term perspective, is trying to develop some set of guidelines implementing food, health and sustainability. I think there is so many overlapping areas of interests, and the GFR is of course a network, and so is EAT. We collaborate with partners, academic partners, R&D partners, strategic partners, and this is actually in order to exploit synergies and align forces towards the common goal on a more healthy and sustainable global food systems. So I think that your initiative could actually open up an extremely interesting arena for partners to contribute and work together. Traditionally, the health, nutrition aspects of food has been addressed kind of independent of the environment. But these days, with climate change, also biodiversity, you cannot discuss nutrition and food security in a long-term perspective without integrating all the aspects. And our former Prime Minister and former DG of WHO, Gunhild, she said it with the Brundtland Commission that she was behind the definition of sustainability in general, but also that everything is connected to everything. And I think part of this is to see that some of today's biggest challenges with the increase or the increasing burden of NCDs and obesity on the one hand, and climate change and environmental challenges on the other. These issues are not only highly interconnected, but there's also a space for common opportunities and solutions if you are aligning strategies. I think that women are key to change, in particular if you're looking to on development in general in low and middle income countries. Women are key. Getting the gender issue right is so important. And within the family, the women are deciding to a large extent what the children are eating, and this is related to, of course, ability to go to school and ensuring a healthy family. So I think without addressing the gender issue, we are actually unable to solve these issues. You know, the EAT is actually a very young initiative, so we started just before the summer 2013, but it has been growing tremendously fast and surprisingly fast actually. And I think this is because it's actually a need out there. We as you have discovered as well. So I think by aligning forces and by working together and building momentum up to ICM2 and see through, because there is much more than a series of conferences. This is an effort to build extensive networks, sharing best practice, sharing knowledge, and actually coordinate an orchestra of different partners with different perspectives and different evidence, and kind of integrating this. So I think by aligning with partners such as GFR, it's increasingly important for both initiatives and will be a bilateral win-win.